So we're going to start. You've been asked by your consultant, Mr. Mead, to see a 59-year-old female patient who is being prepped for a colonoscopy. When you read through the clinic notes, you see that she has been suffering from PR bleeding and weight loss over the past 2 months. Please talk to the patient and consent her for a colonoscopy and consult her about colonoscopy.
Okay, so she has come to the OPD, right?
Clinic. Yeah, she had
Yeah.
PR bleed multiple times and weight loss, and she's being prepared for an elective or outpatient colonoscopy. Would like you to consent her and talk to the patient and address her concerns.
Okay.
Whenever you're ready, you can start.
Okay.
And please,
Okay.
someone else can time us for 9 minutes. You don't have to give us any prompt, just 9 minutes, and at 9 minutes, say 9 minutes done.
What was the name of the patient?
Let's call her Leslie.
Yes. Hello, I'm Dr. Saad, one of the doctors looking after you. Can I please confirm your name and age, please?
Hi, my name is Leslie, and I'm a 55-year-old.
Okay, pleased to meet you, Mrs. Leslie. Um, Before I begin, can I know in your own words, uh, what do you think is wrong with you?
Yeah, well, I don't think there was anything wrong with me, doctor. It's just I've been for the last 2 months. I had bleeding per my back passage, and I've lost lots of weight as well, and I'm quite worried. And I've been told through a letter that was sent to my house that I'm having a colonoscopy done. And I heard about this procedure before. And my dad had this procedure before he dies, long time ago, and he had a complication from it, and I'm quite worried as well. So I was wondering if you can, sort of talk to me through the procedure and what I need to worry about really.
So sorry, Mrs. Lizzie, to hear about your dad. Uh, can you tell me what he was suffering from? Do you have an idea?
Well, he had a colon cancer, and he had a colonoscopy and was diagnosed after that, and
Okay.
and then and then he had an operation, but that was long time ago. It's more than 20 years ago.
Okay. Okay. So sorry to hear that again. Okay, the procedure we are going to do is, as you said, a colonoscopy, and the benefits of the procedure is we'll able to look inside your colon and able to find what causing your bleeding. If possible, we'd like to take a tissue sample to look under the microscope what you are suffering from, and if we find any bleeding vessels, anything like that, we can help stop them. Okay, are you following me?
Yeah, so are you saying I might get bleeding? Is that what you said?
No, no, you are already bleeding. So if we find the bleeding point, we can
Oh,
help
okay.
stop it by cauterizing. Okay.
Okay. Yeah, so is there any other reason we're doing this procedure apart from the bleeding that I have?
Uh, Pardon me?
Is there any other reason that you're doing this procedure to me apart from the bleeding? Are you worried about anything?
Yes,
Because,
yes. If we
yeah.
find something, growth or anything in your intestines that may be responsible from this bleeding, we can take a sample of your tissue, of that tissue, to look under a microscope what exactly that is.
Okay.
Okay. So
Well,
what we
yeah,
do in this, yes.
yeah, go on.
Yes, what we do in this procedure is a kind of a tubular structure. So there is a camera, it's very small camera at the end of the tube, and we insert that through the back passage, and it's connected to a TV, and then we are able to see what's going on inside. All right. So for this, we generally don't put the patient to sleep. We'll give you a medication which will kind of make you a bit drowsy, but you won't go to sleep, but you won't feel anxious. Uh, I, I don't think you will feel any pain. You might feel the sensation of pulling, and the operator might ask you to change your positions. but you'll be fine. Um, as you know, Mrs. Lizzie, unfortunately, no intervention or procedure is without complications. So I'd like to talk to you about the risk of this procedure. Would that be fine?
Yes, please. I'm quite worried about it. Like I said,
Okay.
my dad had an issue from it, so I'm quite worried, to be honest. Is that okay if you just mention
Yes, yes,
the
sure,
the other
sure, sure,
possibilities? Yeah.
sure. So one of the risk is we might cause some injury to some of the tissues in your intestine. So you may have some bleeding after the procedure, but we'll try to be as careful as possible. And if there is a bleeding, we'll deal with it, and hopefully it will become all right soon. A serious complication is of this procedure is we may inadvertently poke a hole in your intestine. So for that, you'll have to undergo another procedure to patch that up. Apart from that, you may feel the sensation that you need to pass gas during the procedure. It might be embarrassing, but please don't worry about that. So these are some of the risks related to the procedure itself. And if there is a procedure related to anesthesia, I think the anesthetist will be a better place to answer it, and they will see you in a while. All right.
Okay, doctor, I feel like the risks are quite a lot, and my experience with this procedure is not really good. Are you able to find any other alternative that I can avoid having this procedure?
Yes, Miss Lizzie, I completely understand your personal experience and your apprehension. We will not ask you to do any procedure against your will. The alternatives to these procedures are other investigations. We could do MRI. It's a kind of big machine. Have you ever heard of an MRI?
Yeah, I know that it's quite loud and take lots of time as
Yes,
well, and
yes,
then
yes,
get a
yes,
bit
exactly.
claustrophobic.
Yes,
So,
yes. So yes, it's if you are claustrophobic, so that's an issue with that. So that's one investigation could be done. Another investigation is what we called barium enema, in which we give you enema of some radio opaque material that are dark materials, which we can see in an X-ray, and then we take some dynamic X-ray. That's basically like a motion picture X-ray, and we kind of get of an idea about what's wrong with your bowel. But let me tell you, if we find anything of note in these investigation, we'll have to ultimately do a colonoscopy to look inside and look at the tissue and maybe take a sample or a biopsy from it. Are you following me?
So 9 minute up.
9 minutes. Okay.
Oh no, no,
Uh,
sorry, 7 minutes.
six.
Sorry.
Okay,
Carry on, please. Sorry.
that's fine. So, okay, yeah, doctor, I'm actually following, but I don't know. It's a quite difficult decision, but do you think it's worth taking the risk and having, is it the best procedure that you might do for me that will help diagnose and treat me at the same time?
Yes, in my opinion is that yes, this procedure has risks, but the benefits of this procedure outweigh the risks. And if you take my opinion, of course, nobody is going to make you do anything you don't want. But in my opinion, you should go ahead and hopefully will be all right after that.
Okay. And do I need to, will I be allowed to eat before the procedure or?
Uh, Basically, this procedure, 2 days before the procedure, you'll have to commence liquid only diet. One day before the procedure, we'll give you some enema right now. That are some sachets you'll have to take to clear your bowel, so all that your stools are clear from your intestine. So I would ask you to stay home, and 6 hours before the procedure, we would ask you to eat nothing, so you will be nil paloran. Don't worry if you don't remember all these things. I'll give you a leaflet, and everything I have been telling you, it's written in that. All right.
Okay,
Okay. So
fine.
the
And
procedure in yes, yes, Miss Lizzie.
also the my medications, am I allowed to continue taking these medications or not?
What are you taking right now?
So I just take some aspirin because I had, I had a previous stroke.
Yes, you would be allowed to take the aspirin. So, day of the surgery, you can take it with a sip of water. So do you have any, are you on any blood thinners apart from aspirin? Anything
No,
at
just
all?
aspirin that I take.
Just the aspirin. Okay.
Mm.
Okay. As you'd be taking some uh, uh, anxiolytics, I would ask someone to accompany you here. So because you'd not be allowed to drive or operate heavy machinery 24 hours since 24 hours after the procedure. So it would be better if someone can accompany you. That'd be fine.
Okay, that's fine. And when am I expected to
Now
get
time
my
is up.
results?
Now time is up.
Okay.
9 minutes now.
Yes.
Before I give you feedback.
I did the consent scenario with you a few days back. I think I did slightly better this time, lesser interruptions, and I think I covered all the concerns of the patient. Took it a little longer. I couldn't close it properly, but apart from that, I think it was okay-ish.
Yeah, yeah, I think so. I think you've explained it pretty well. Um, just a few things. Just a few things. One, you started the scenario by what's wrong with you, so I think that term is not really well used. I would
Okay.
change it to a slightly better term instead of what's wrong with you, because it doesn't seem right when you ask someone this question. So I would simply say, um, I mean, let me just to get a context. So I'm here today to help you, or how can I help? Or we're gonna figure you out and see what can we do for you, things like that, and instead of what's wrong, to find out what's wrong with you. Okay,
Okay.
that's comment one. Comment two, when you at the end when you were explaining, you said it's a camera test that going through your intestines. The intestine is a medical term. Try to avoid using medical jargons. So maybe simply say your bowels, right? So they're familiar
Okay.
with the term bowels, but not intestines. Okay.
Okay.
Um, the last thing is when you said, when I asked you about the am I gonna be fasting, and you said yes, you will be before. No, yes, you said before 2 days prior to the procedure, you're gonna be in liquid diet, liquid only diet. Well, absolutely, that's the right answer, liquid only diet. But try to explain this, what it means. So in my opinion, I'm going to say, yes, you will need to be in a little bit liquid diet. And this includes, you can have some juice. You can maybe get lots of water as much as you can. You can drink milk. You can, you know what I mean? Just to try to explain it with some examples so the patient knows what a liquid diet is. Okay. Because liquid is quite, broad term. Okay.
Okay.
So try to give some examples. And also when the patient asks you a question that seems it's a good question, and actually asking will I be fasting before, it's actually a good question. So try to praise them, or maybe encourage them. You just say, well, that's actually an excellent question. Thank you for bringing this up. And it's one of the important issues that I need to discuss with you. So 2 days prior to the procedure, you will be on liquid diet, and this includes maybe you can take more fluids and more this or this and this and so on. All right. So try to praise the patient when they ask you an important question that's a crucial part of the management. All right. Um, well, as a general feedback, I think generally you've done pretty well. Yeah, I think you've done with me till now 3 scenarios. Your second scenario was the best. The first and the third, there is a room for improvement.
Okay.
So in this one, again, I think you were explaining more than I would, or more than I would expect a candidate to explain. So try to make it simple. Do not explain too much unless the patient asks you a special question. And also when you start explaining, just make some pauses. So for example, when I'm going to explain the procedure, I'm going to say, well, it's a camera test. Have you ever had any of those before? I'll say, no, I've never had. Do you know anyone? I know you have, your father had it before. What's your experience with that? Try to explore more. And then, well, it's basically like you said, it's a camera test that goes from the back passage, which will make us look at a screen and have look at your interior or your bowel in more detail. It can help us in finding any masses, any bleeding source, or maybe something called polyps, which is, you know, so like a pouch coming from the wall, and that's it. This is how I would explain it at the start, and then I'm gonna wait. I don't have to say, well, are you following? That's fine. I'm gonna wait and say and see how the patient interacts with what I just said. If they said anything, fine. If not, I'm gonna continue and will say, well, it's not. I wouldn't expect it to be painful, but it might be a little bit uncomfortable because obviously there is a tube in the back passage. You might feel a little bit drowsy and things like that. So try to make a little bit of interactive conversation because, like I said, this from the name of the scenario, it's a communication scenario. So you're here to communicate and not just sharing your knowledge. So that's that's the other thing that I will say, to be honest. Um, when I asked about alternative, I felt like you were encouraging me to have an alternative. So it's important to tell you to be honest with your patient and tell them about the alternatives, and at the same time telling them your opinion that the best one will be this. So the way I'm going to explain the alternatives, well, yes, there is always alternatives that we can do for you. However, I believe that colonoscopy for the camera test will be the best one because it will help us to look on the inside and also take some samples, and this will tell us like the exact diagnosis if there is any issue. However, there is something we can do. It's called, you know, it's an image with a scan. It's called barium enema. It has less risks, but it's not as good as the CT, the colonoscopy. We also have an MRI, and so on. You can continue doing that. But in my opinion, I would not encourage, but I will guide the patient or give them my honest opinion that the best investigation will be this one and instead of this one. Okay, you explained the risk quite well. I think we agreed last time when we were talking about the risks to make the combination between mentioning the risk and also the treatment at the same time, which I think you have done this time very well. So you said yes, there is a risk of you know, the perforation, and you explained it quite well. And then you said we're gonna be very careful. We'll do our best to avoid that, and if it happened, we can deal with that, and so on. Yeah, you've done this very well, to be honest. Mrs. You know, call her Leslie again. She's 75-year-old female patient. She had mastectomy with axillary clearance 2 days ago, and there is axillary swelling, and her wound suction drain has 90 ml of fresh blood in it. And she had shortness of breath, background of COPD, mild left ventricular failure. Her daughter wants her to take her home, and she lives 60 miles away. You spend 20 minutes trying to persuade her to
Oh,
stay, but
I have done this already. Should I do it again?
sorry,
I have done this one with you already.
was it with me? Really? I don't think so.
Yes, the daughter has history of schizophrenia and uh, uh, something like that, right? Or this is different one. Okay.
I think it's different. It's a discharge of a mastectomy, and you need to speak with a consultant
Okay.
about this. I don't think that we've done it before.
Okay. Okay.
Okay.
So Leslie, 75-year-old female, mastectomy, axillary swelling, shortness of breath, mild LVH, and 90 ml in drain. Mastectomy, how
Yep.
many days back?
2 days ago.
Days. Okay. And the consultant name is Dr. Abdullah.
Yeah, speak with a consultant. Yeah, speak with a consultant and update him about the patient and discuss with him the discharge against medical advice.
Okay.
Whenever you're ready.
Hello, hello. I'm Dr. Saad, one of the SHOs working in the general surgery department. May I confirm that I'm talking to Mr. Dr. Abdullah?
Yeah, hi there. Hi, Sad. How can I help?
Okay, okay. Sorry, doctor, to bother you at this time. Is it a good time to talk about a patient?
Yeah, of course. Hit me.
Yes. Okay, so the 75-year-old lady, Mrs. Lizzie, she underwent a mastectomy 2 days back. Uh, Presently, she is admitted under you, and Her complaints right now are axillary swelling and some shortness of breath, but she's otherwise all right. I'm talking to you to seek advice because her daughter has just arrived and she wants to take her mother home against advice. So, can you advise me about that, please?
Yeah, of course. So did you speak with the daughter or not?
Yes, I speak with the I have spoken with the daughter and the patient as well, and I just spent around 20 minutes trying to convince them that it would not be right to go home right now, but they are adamant that the daughter is adamant that the mother is all right and she wants to take her home.
Okay, did you speak with the patient as well? Does she have capacity or not?
Yes, she has capacity. She is understanding all the risks and the dangers I have explained to her. She is weighing up the information and looking at the pros and cons. She is able to tell me her decision quite accurately.
Okay, and how is she doing? Is she safe to go home?
In my opinion, I would like her to stay for some more time because she has some axillary swelling and recently some shortness of breath. So there are some things that I would like to rule out and make sure that she is safe before she leaves the hospital.
What are you worried about?
Shortness of breath can be due to a number of causes. One of them could be pulmonary embolism as a result of deep venous thrombosis. She has a background of heart disease, so I am also suspecting. I also want to rule out any heart conditions like myocardial infarction or left ventricular failure. Other causes can be she's admitted for a while and it's been 3 days post surgery, so I would also like to rule out any chest infection, ARDS, things like that.
Yeah, I also remember that she had a COPD, did she?
Yes, sorry, doctor, I forgot to tell you. Yes, she has a history of background history of COPD as well.
Okay. Yeah, can we also consider, if she needs, assessment for exacerbation of COPD, if that's okay?
Yes, yes, I think you're
Okay.
right. We will also have to put that as a differential diagnosis.
Yeah, of course. And also, so you spoke with her, and she has capacity, and she's adamant to go home, and you spoke with the
Yes,
daughter, and they both have capacity. Okay. So what would you
yes,
like to do
yes.
now?
Uh, yes, since they are adamant and they want to leave, I would like to ask them to repeat the dangers and everything I've told them. They've already done that, but I would like to do it again. After that, I'll explain to them the danger signs for which they have to come to the hospital immediately, and hopefully they will agree to that. And after that, they would have to sign a legal document uh, accepting that all
Okay.
the risks and dangers have been explained and they are prepared to take those risks.
Yeah. All right. Okay. Well, does she still have a drain in?
Yes, she still has a drain in. It current volume is around 90 ml of serous fluid.
90 mil.
Yes, 90 ml.
Are we worried about bleeding or something?
Uh, yes, that could be a possibility. Yes, and could be another cause of her shortness of breath. She could be in the early stages of hypovolemic shock. But
Yeah.
after I
So
get off the,
so
yes,
yeah. I mean, thanks for calling me. What I would advise is I would advise you go. Yeah, what I would advise is speak with the patient again and do
yes,
do an important assessment for, the shortness of breath, and also
okay,
the do assessment to the wound if she might be bleeding from the wound at all, and
yes,
just make sure that she's clinically safe first, and then if you think she's safe, you can speak with her again,
okay,
try to convince her to stay, And if
Okay.
she's not convinced and you think that she needs further investigation, we need to get her to sign a form that she's discharged against medical advice. Otherwise, just make sure that she's safety netted before she goes home, and tell her to go to the nearest hospital if anything happens to her. Okay?
Okay. Thanks for the
Would you
advice,
like me to
doctor.
come and see her? I'm around. Would you
Uh,
like me to come and see her, or you're happy to do that?
I would happy to do that, and if the condition deteriorate, God forbid, I'll update you, and you can come in then. But presently, she's all right.
Okay.
Okay.
Okay. Yeah.
Thank you, doctor. I'll
Thank
keep you
Thank you.
updated.
So finally, Sad, what do you think?
I think the initial, as soon as the conversation starts, I think I'm not doing too well in summarizing the things properly. Like you said, in these scenarios, everything is in the start, and you have to summarize things properly and immediately
Yeah,
get to the point, something like that. I think I'm messing things
exactly.
up there.
Yeah, I'm really glad that you're aware of this. I'm really glad that means that I will be able to do better next time. So like I said, I prefer writing my notes. As you know, that I write all my notes. So I prefer writing it in this way. So literally, when I'm calling my consultant, I'm gonna mention all of this on one go.
Yes.
All right. So I'm gonna
Okay.
say I had a 78-year-old female patient who underwent mastectomy and the clearance 2 days ago. By the way, you said that she's under your care. It doesn't necessarily mean that she's under his care. He might be the on-call consultant. So don't
Okay.
assume unless it's clearly mentioned in the notes.
Okay.
Then I'm calling you regarding her drain has 90 ml of blood and she's short of breath. All right. The
Yes.
problem is her daughter wants to take her home. So I'm quite worried about discharging her against medical advice. So I would like to take further advice from you. Okay.
Okay.
Or
Okay.
if you think to come in, which I believe is not a problem. You can ask them to come in and speak with them if you think they're not convinced by your opinion. So I
Okay.
would say at the beginning, I would like you to come and see her if you're available. If you have time, I would like you to come and see her with me to speak with her. Okay. And obviously, go to the background. She had breast surgery 2 days ago, and then she has also background of COPD. Currently, she's short of breath, and the drain has 90 ml. I, what I will do now, I'm gonna go and re-examine her to make sure that she's not bleeding, to make sure that the wound is fine. I will do a chest exam and I'll examine the calf muscles as well to make sure that she doesn't have any DVT. And I will also speak with them again about the discharge. I mean, before that, I will speak with them again about the discharge. And if they're happy for me to get some investigations done, this will include an ECG, routine bloods, FBC, UNE, CRP, LFT, and I will consider blood cultures if I'm worried about infection, and also a CTPA if I'm worried about pulmonary. After doing all of, if they agreed to do the investigation, that would be great. But I will mention to them that they will need to stay in the hospital for a few days. And if they refused, I would like to ask you to come with me, please, and review them to try to convince them. And if not, our last option will be discharging them against medical advice, and I will get them to sign a paper. But I would appreciate your input in this before I move on and discharge them. Okay. So I think when you
Okay.
say that, because to be honest, I know we're used to, just sort everything out by yourself, and you're quite worried to ask your consultant to come in. I think it's absolutely fine. And in this condition, when you have a patient with 90 ml of blood, you might be worried about wound, hematoma. She might need to go back
Yes.
to theater. You will never know. And also, when you have someone with shortness of breath 2 days after surgery, quite old, with high risk of pulmonary embolism, well, I wouldn't mind asking my consultant to come in and see her if that's appropriate, or at least make the decision with me. All right. And of course, if you find sometimes, and I think this can happen, I'm not sure if it happened before. Sometimes the consultant might, say, do you think you need me in that? So, well, you can always say, well, yes, I think it would be a great learning experience for me as well, to see you managing this difficult condition, and I will be very happy to learn from it. All right. So we can say something like this. So you're basically reflecting on your own learning and also keeping the patient safety as well. All right. So that would be, if you think that asking your consultant to come in is not a great idea, well, it might be a good learning experience for you to ask him to come in. But anyways, I think generally you've done well. It's not bad, but you're aware of the issue, which is the summarizing at the beginning, and I think we'll be able to do it better. All right.
Okay, thank you.
Thank you very much. I'm sorry, guys, about my internet connection today, so I think I'll have to go now because, to be honest, the voice has been interrupting a little bit. So I'll have to go now, and I'll see you tomorrow.
Okay, thank you so much.
All right. Thank you.